Erectile dysfunction means the penis cannot become firm enough to intercourse. Let me explain this very simple and also explain what a penile implant does. First, a healthy penis does not contain muscle, bone, or any solid structure that make it hard. Inside the penis, there are blood-fed sponge-like tissue. When blood is pumped into this tissue and trapped there, the penis becomes firm and strong for sexual activity. If for any reason the blood flow is reduced or the blood that enters the penis is not enough or cannot stay trapped, the penis will not become fully rigid for intercourse. In mild cases, oral medications can help by increasing blood flow to the penis. But in severe cases, pills may not work. When other treatments also fail, the implant is placed inside the penis in the same area where this tissue normally exists, allowing the penis to become firm enough for intercourse again.